Please enjoy this interview with Lisa Chappelle, Vice President of Local Services with Child Care Services Association. Thank you. For a description of CCSA services, and would you please introduce yourself in your role here?
I'm Linda Chappelle. I have the big long title that basically just means that we provide local services, but I'm the Senior Vice President for Child Care Resource and Referral Services of the Triangle. And we are the local service team, which means we provide consumer education and referral for parents, professional development for early childhood providers, and technical assistance to child care programs, to regulated child care programs.
Okay.
And we also provide a few other services such as health and nutrition, education.
Things that I use.
Yes,
we utilize all your services.
But we're the local services component of child care services.
Okay. Well, that answered my first question, was what types of services are offered through CCSA. And is there anything else you'd like to add to that?
Sure. Yeah. Child Care Services Association, we as a child care resource and referral agency, we have a very broad list of services, but our mission is to assure access and equity in high quality early education. And so, all of our work is aligned with that mission to try to address the early childhood system, to support it and advocate for it and expand the quality available, but also to connect families to the opportunities provided by high quality early education. Okay. And we do that work through direct services, but also through research, public policy advocacy, public policy research, and also through a variety of programs that are local as well as regional, statewide, and national. Okay. So we have national programs in other divisions of our agency, such as the TEACH program that provides education opportunities for our early childhood teachers, as well as the WAGES program. Those are licensed in other states. Okay. So, but my particular group, we do the local services. Okay. We serve Region 12, which is Durham, Orange Wake, Caswell, Alamance, Person County, Franklin, Granville, and Vance County. Okay. So there's 9 counties.
That's a large region.
Yeah, but our primary service area is Durham, Orange Wake, but we work with other agencies in those other 6 counties in Region 12 to facilitate services. And we do consumer education and referral in all 9 counties.
Can you explain a little bit about how it's delivered, how those services are?
Sure, yeah. So for our local services, we kind of think of it in 3 components. We have our parent services, and then we have our provider services, and then we have what we really do across all different groups, our community agencies and partners. So our local services for consumer education and referral are focused on parents, our parent services. So family support, it's the Department of Family Support. Family support works with families to connect them to resources to help afford childcare, high quality childcare. We educate parents about what the early childhood system in North Carolina is, what it provides, what quality looks like, and we help families access the high quality by helping connect them to financial resources, to high quality programs that meet their needs. We have a child care database. We have all the regulated child care in the 9-county area in that database, along with information about all of those. And we connect families to those programs. We don't recommend programs, but we do connect them to programs that meet their criteria that they need. And so the parent piece that's really strong is we also facilitate registration in some counties to programs through universal application, like NC Pre-K, as well as Head Start and Early Head Start. We work with other agencies collaboratively to enroll children in those activities. And so families, for example, in Durham, for example, we actually manage all the appointments for NC Pre-K and work collaboratively with other agencies to assure that NC Pre-K reaches into the community, enrolls children that are eligible, and maintains a wait list that's viable so that they can assure those spaces are filled, along with Head Start. And we also work closely with DSS. We actually have a scholarship program that provides financial assistance for families in Durham and Orange counties.
Okay, I was going to ask you about that. That was something that I have not utilized,
Right.
but it's because it's for
Obviously,
Durham and
you
Orange.
work in Wake, right? We in Wake County, what we do around financial assistance for Wake County is we educate parents about what's available, and we connect them to DSS, Wake County DSS, Human Services. They administer the Wake County scholarships. Well, vouchers.
Right, okay.
A voucher program is a little bit different. We operate a scholarship program for Durham and Orange. We receive money through Smart Start to do that, as well as through private entities. We're in some collective impact projects through United Way.
Okay.
For example, the Family Success Alliance in Orange County. In Durham County, we're a part of the EDCI, the East Durham Children's Initiative Collaborative, and those provide scholarships, child care scholarships for families. So money comes through those projects. We administer a scholarship program. What's different about a scholarship program versus the traditional voucher program for child care financial assistance is that one of the key differences is that our parameters for eligibility are different than the state voucher program.
Okay.
For example, we have priorities that are different. Like we prioritize teen parents, homeless families, families who might be engaged in a problem around domestic violence, or other types of emergency services, or families who have a disability within the family that creates problems with work. You know, the voucher program is very much focused on working families,
Right.
and if you're not working, you can't access assistance. Our program is a little bit more flexible. The difference is that for voucher programs, they are primarily concerned with the family sustainability. It's a family resource issue. In our program, our priority is child development.
Okay.
And so many of our program standards relate to what is best for the child's development. So continuity of care, you know, we will only allow enrollment in 4- and 5-star programs. The challenges that happen to families sometimes in a voucher system can interrupt care for a child, and the voucher can be terminated.
Right.
Whereas our program has more flexible guidelines around that in order to maintain continuity of care for the child.
Wonderful.
Because it's just a different lens to look through. So, but and also the financial requirements are a little bit different. They're broader. Many times, the threshold to be eligible for a voucher through the state program, you have less income, and in the scholarship program we have a little bit broader income guidelines.
Right. Because it's
because
not
of
about
working
that.
families, right? And obviously we know that families that people don't traditionally think of as being in poverty still can't afford child care.
Absolutely.
We know that. Obviously we know
child
that.
care workers can't afford
Yes,
child
exactly.
care.
Yes, exactly. Yeah, and that's the other piece of what our agency does outside of our local service program is we focus very much on the workforce. You know, professional development, the TEACH program. A lot of our research is around the workforce, trying to educate the public and inform public policy around the reality for child care workers.
Right.
You know, what it looks like. In fact, I was just reading, we're about to release the infant toddler study in North Carolina,
Right.
and I was just reading some of the preliminary information, and you know, the number of our teachers that qualify for public assistance is something that we should all be very concerned about.
Right.
Based on the wages that
I'll be
are
curious
available.
to read that one.
Yeah,
when it gets out. I've looked at
it'll
the
be out
most. I looked
soon.
at the 2015, whichever one's on the website.
Right.
But,
Yeah, there's about to be an update related. But anyway, in terms of local services, besides our family support services, we also provide services to child care providers, to early educators. We have professional development workshops, of course, that meet the Division of Child Development and Early Education requirements. But then beyond that, we do a lot of professional development around the class learning tool that really looks at classroom instruction. And of course, that's not required by the Division of Child Development and Early Education. But we also do professional development, of course, grounded in the foundations work that the state has put out. And professional development, we in each county we offer direct workshops, but we also work with other agencies to facilitate workshops for early childhood providers. So both of those things. And then we provide technical assistance in Durham, Orange, and Wake. The technical assistance team really focuses on quality improvement and on moving high quality programs beyond the basics.
Unfortunately, the end of our interview was cut off by our video. But to complete this project, I chose to interview a former personnel, a current technical assistance provider, as well as Linda, and studying the annual report. I hope that you were able to learn some things about this organization if you were not familiar with them. And I have enjoyed completing this case study on Child Care Services Association. Thank you.